I always say stress and trauma are not necessarily the cause of functional neurological disorder. The reason I say that all the time is not just because I want to spread awareness, stop people from digging for trauma when there might not be any. Trust the patients if they say there was a traumatic event or wasn't. And more importantly, the treatment that addresses just stress or just the trauma does not always make the FND go away. Treatment of FND often can include components of stress reduction, but most of it is some type of rehabilitation approach. So whatever specific type of therapy you're using, there will always be a rehab approach somewhere in there. And always it has to be multidisciplinary. So neurology, psychology, physical therapy, and any other subspecialties depending on that particular patient's need. So it's not just that I am stuck on this idea because I think it's important for people to know just for the sake of knowledge, but also because it directly affect treatment. Referring someone who has FND to a trauma specialist or an anxiety specialist might not necessarily treat the actual FND. Yes, it will improve quality of life, most likely, and we do want to address trauma, maybe even before we address FND, but that alone will not, I would not expect that alone to resolve FND symptoms.